Hello everyone. In this video, I'm going to talk about Mometasone cream. Mometasone Furoate is a topical corticosteroid. It has strong anti-inflammatory actions. It is available as a cream, lotion, and ointment for topical use on the skin. It is also available as a nasal spray for symptomatic treatment of allergic rhinitis. Mometasone topical formulations can be used for treating inflammatory skin conditions like atopic dermatitis or eczema. It is a chronic skin condition that causes inflammation, redness, and itching. It also produces some thickened and scaly skin. It can also be used for inflammatory conditions that affect the skin, hair, and nails. This video explores key information about this medication, like what its effect is on the eye, how it affects your skin, what happens when it enters the body, and how to use this cream. First, let's see how to use this medication. Mometasone is available as a cream, lotion, and ointment. All these formulations are available at a strength of 0.1%. How much cream you're going to apply depends on the area of the skin affected. Always apply a thin film of the cream to the affected area as recommended by your doctor. Typically, this cream should be used once a day. Applying more times per day than recommended may increase the systemic exposure. Wash your hands before and after application of the cream. Try to avoid contact of this medication with your eye. This medication is not intended for oral and intravaginal use. Now let's see the precautions for this medication. Mometasone is not an antibacterial agent. Therefore, it cannot reduce any existing bacterial, viral, or fungal infection. Instead, it can worsen the infection if it is used alone. Being a steroidal medication, Mometasone can reduce the immune response. This may result in a delay in wound healing, and sometimes a few of the infections may be worsened. Therefore, in case of bacterial or fungal infection, a suitable antibacterial or antifungal agent should be used. Few of the formulations contain antibacterial agents combined with Mometasone. Such combinations can work better in the presence of infections as they reduce both infection and underlying inflammation. In order to avoid resistant infections and delay in wound healing, Mometasone should be properly used for indicated uses only. Even in the absence of infection, Mometasone should be appropriately used. Overuse of this medication can suppress the immunity locally. This may increase fungal, bacterial, and viral infections. In case of such infections identified, a specific treatment with anti-infective medication is recommended, as Mometasone alone is not effective. Mometasone can affect your vision if it reaches the eye. Therefore, you should avoid contact of this medication with the eye. Initially, with contact with Mometasone, you may have eye irritation and dryness. However, it may also increase the risk of absorption of this medication into the body. On significant exposure, it can affect your vision. Mometasone can increase the risk of developing cataracts and glaucoma when it reaches significant levels in your body. Therefore, try to notice any unusual changes in the vision while using this medication. You may have blurred vision and difficulty seeing at night. Your vision is cloudy and dull. You may also have halos in the vision. If you notice such symptoms while using Mometasone, an ophthalmic examination should be done. The risk may be more pronounced in the elderly. In case of any accidental contact, immediately wash with plain water. Topical application of Mometasone can produce a condition called allergic contact dermatitis. This is a hypersensitive reaction that is due to contact with an external agent. It is a natural reaction of the skin towards an irritant or an allergen. In people with sensitive skin, Mometasone can act as an allergen and induce an immune response. This promotes the local inflammation. Therefore, it can produce skin rashes, itching, and blisters on the skin. Even though Mometasone reduces skin inflammation, it can also produce this allergic contact dermatitis, leading to a red and itchy rash. It may just resemble symptoms of skin inflammation you have. However, this contact dermatitis is only limited to the area where this medication is in contact. In case of the development of contact dermatitis, you can notice a failure of healing of skin inflammation. Therefore, if sufficient response is not achieved even after 2 weeks of treatment with Mometasone, it may be discontinued. Absorption of Mometasone into your body can produce a few serious adverse reactions. Therefore, you have to minimize the use of Mometasone cream to reduce the risk of systemic absorption. Also check if you are using any other corticosteroids, either orally or topically, which may further increase the systemic exposure. Normally, oral corticosteroids can be given to you to control the inflammation. If you're combining these oral corticosteroids along with a topical cream like Mometasone, it may increase systemic exposure. You should use Mometasone in very low amounts as required, and it should be applied only at the affected area. Overuse of this medication may result in the suppression of the HPA axis. When it is used for longer periods greater than 2 weeks, it may have a chance of developing suppression of the HPA axis. Suppression of this axis results in the development of a few symptoms that resemble Cushing's syndrome. In this condition, blood glucose levels are elevated. Glucose is more excreted in the urine. Fat is unequally distributed, resulting in a round face. If you are applying this cream to larger surface areas or you are using it for prolonged periods longer than recommended, this risk may be increased. Use of occlusive dressings can also increase the systemic absorption. Therefore, unless your doctor suggests it, never use occlusive dressings. If you have any altered skin barrier with a higher chance of absorption, the use of this cream may increase systemic exposure. When Mometasone is used for children, it should always be used in very minimal quantities. The systemic toxicity may be more pronounced in children, as their skin is more sensitive and more permeable. Even accidental consumption of this medication will be more in the children. Therefore, it shouldn't be used for more than 3 weeks in children. Now let us see the side effects of Mometasone cream. Mometasone can induce a few local adverse reactions. It can produce burning, itching, and local irritation on the skin. You may get some marks on the skin that appear like a few streaks or lines. You may also have dry skin at the applied area. Small raised bumps may develop on the skin that look like acne. You may feel tenderness and itching at these bumps. Your skin may become thin where you are applying the cream. It can be easily fragile. Mometasone cream can produce some change in your pigmentation, leading to some dark and white scratches. You may also observe a red rash around the mouth and nose. How does it work? Mometasone reduces the inflammation by stabilizing lysosomal membranes. This reduces the release of leukocytes that actually develop inflammation. It also prevents the release of a few enzymes called acid hydrolases that produce damage to your skin. It also inhibits the accumulation of mediators that increase the inflammation. Mometasone can reduce the adhesion of leukocytes to your blood capillaries, which further inhibits inflammatory response. It also reduces the capillary wall permeability that may decrease the chance of swelling and edema. Mometasone also reduces the histamine activity. All these collectively can produce anti-inflammatory activity that reduces skin inflammation. This cream is used for topical purposes, so it shows percutaneous absorption. However, the extent of absorption depends on the type of formulation you're going to use. It also depends on how your skin is and what the integrity of the epidermal layers is. In the case of intact skin, the absorption may be limited. In case of skin injury, the surface is more permeable to the medication. Similarly, if occlusive dressings are used, the extent of absorption may be increased into the systemic circulation. These are the important things about Mometasone topical cream and how to use it. That's all, guys. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.